Widespread confusion and skepticism over whether the president's health care law will help or hurt. Those are the findings from our new Wall Street Journal NBC News poll. Here to tell us more is healthcare reporter Louise Radnofsky in Washington. Thanks for being here, Louise.
For having me. Good to see you again.
Good to see you. So this seems like it's been a much harder sell than the president and his allies predicted.
Well, it's been 3.5 years. There's a high proportion of Americans who still don't know how they feel about that. That does create a hard sell for people who are trying to get them to sign up. It also creates a real window of opportunity for people who want to shape public opinion against the law. It's certainly still soft and malleable.
You can see there in this slide that there are a lot of people who just don't understand what Obamacare is about still.
Right. There's a lot of people who don't feel it's going to have much of an impact on them or their family either, in some cases because it probably isn't given the type of insurance they have, but also in some cases because they are uninsured. There's sort of people who need to know about it and they don't. But yes, there's a high degree of people who are confused about the law to start with, and then beyond that, when they're asked how they feel about it, they don't know or they feel negatively.
And one number in your story that was just really shocking to me was this: 34% of people who don't have insurance said they thought the new healthcare law would have a negative effect on their family. These are people who don't have any coverage right now.
These are people who don't have any coverage right now, who stand to gain from the opportunity to purchase through the exchange, often getting subsidies if they're relatively low income, but also people who are subject and most affected by the individual mandate that they have it. And that's been something that people are very aware of. They don't know a lot about the law. They don't know everything's in it. Most people, we've seen previously, tend to know about the mandate. And of course, that's one of the most unpopular elements of it.
So if you have such a high percentage of these people who don't understand how it's going to impact them, they're a little bit skeptical of how it's going to work. I mean, maybe they don't sign up for the exchanges at all. What's at stake here?
Well, what's at stake is whether the exchanges work. There's an assumption that sick people who know they need insurance will either sign up because they'll find their way to the exchanges, or because their health providers will find their way there for them and sign them up. And so you have the prospect of a lot of people who will incur high medical costs coming in to the insurance pools, and the prospect that not a lot of people who are young, healthy will pay the premiums but not end up using a lot of services will come in and balance out that risk. Now, of course, those people could become sick in later years, but at that point, premiums will have spiraled again. And so there's a concern that the risk pool will be seriously distorted.
Mm-hmm. So lots of confusion among individuals and family, but what's the employer reaction been like as this is going through its phases of implementation?
Well, people who have employer-sponsored coverage feel about the same in terms of negativity towards the law as people who don't. There are not a lot of clear reasons for why they might feel that. Some of the poll responses suggested that they'd heard more about general workplace conditions that had changed because of the law, and certainly there have been some high-profile examples of employers who have cut some hours for folks to move them below the 30-hour threshold in advance of what would now be a 2015 requirement to offer people above that threshold coverage or pay a penalty. And then there have also been some changes, UPS suggesting that it's not going to cover workers, spouses who have an offer of coverage from somewhere else, which they in part attributed to the law. So there's a lot of different ideas floating around this, and clearly some of that's filtered down to the respondents.
All right, great. Thanks, Louise, for being with us. I'm sure we'll hear a lot more of this in the coming weeks.